Thank you, John. Yeah, I'm going to talk about kinematically aligned TKA, and I'm going to share with you a couple of cases where unknowingly I made a surgical error and did not fully correct the deformity. My disclosures haven't changed. So by way of overview, because kinematically aligned TKA is designed to restore any deformity to native alignment, by definition, there really shouldn't be any limits if we all agree, or if whoever we're talking to agrees that native alignment is the ultimate goal. The perils from cutting the tibia in more valgus than the native joint line are, and that's really where the discrepancy comes. People say, I don't want to cut the tibia in enough varus. And when you don't do that and you kinematically align the femoral component by removing the amount of bone that you want to put back, you get the following problems. You can get a little mild valgus malalignment and instability, and I'll show you a case. You can get high forces in the medial compartment with pain, stiffness, and progress to varus loosening. And you get rubbing of the knees when the patient walks. So because TKA restores any deformity to the native alignment, as I said, there's no limits. Here's a 66-year-old gentleman with OA of the left knee. And that's his post-op radiograph. Everything looks pretty good. We've restored the native hip-knee ankle angle, the native Q angle, and if we had mechanically aligned this knee, then we would have changed, or the contralateral knee, we would have changed his mechanical axis to neutral instead of varus, and we would have changed his Q angle into a increased or valgus alignment, which may be not proper. Here's a 76-year-old female with OA of the left knee and a little valgus deformity. There we've restored her native alignment and the native Q angle. And on the right knee, if we'd done mechanical alignment, we would have changed the native valgus to a more vertical or neutral axis, and we would have reduced her Q angle, again, away from native or normal. Hence, the increasing risk of complications when you have a constitutional varus or valgus alignment that is on beyond 3, 4, 5 degrees, and you bring it back to neutral. It's a big change for these limbs. Now, cutting the tibia in more valgus than native causes valgus malalignment and can be instability. So here's a tibial component that I didn't cut as much varus as I should have. It was a surgical technique error than the native joint line. And you can see the tibial component was positioned in 3 degrees more valgus on the right. So we'll measure it. It's at 0. So a mechanical axis guy would be all excited about this. But for me, it should have been in 3 degrees of varus. And this is what the limb looks like. And you say, well, it doesn't look too bad. But there's the limb alignments in 6 degrees of valgus, and his other knee, there was no collapse, is 3 degrees of valgus. So we have a 3-degree error on the tibia that's causing this limb malalignment. And what does the patient present with? This fella comes back in, he says, my knee's loose on the lateral side, and it opens and closes in full extension. His Oxford score, by the way, was 43. He says, is it supposed to do this? And this is what it looks like. So it closes, opens. Closes laterally, opens. He doesn't like it, but it's not enough for revision, but it's enough for him to come in and ask me about it. How could you correct this? Well, we could release the MCL and use a thicker liner, but that would increase the valgus alignment of the limb. So what you really want to do is, because the femoral component was aligned kinematically, because we measured the resections with a caliper, and we recorded this on our operative note, we know that the distal femoral joint line is correct. We revise the tibia component into more varus, and when you do that, you restore the native limb alignment and get rid of the laxity. Cutting the tibia in more valgus than native can cause high forces in the medial compartment. This was a guy that we did a orthosensor study on. We didn't cut the varus as much as we should, so here his limb is 3, the other side is 6. And you can see the limb alignment, pretty good. But that side's at 0, and the other side has a native of 3 degrees of varus. So we really would have liked to have cut the tibia a little bit more. And unknowing at the time, if you look, you can see these screenshots of the orthosensor. We had high medial forces of 100 degrees and 100 pounds in extension, 55 at 45 and 56 at 90. It's like a mechanically aligned knee. It's too high. And so you can do the release of the MCL, but that decreases to decrease the medial force, but the valgus alignment of the limb goes up. So our solution is put a recut guide on and cut in another 2 degrees of varus, reduce the high load medial, restore the native laxity, and that is better. So we know that we've done a pretty good job with this when we put our trials in, and in full extension we have no VV laxity. Cutting the tibia and more valgus in native can cause the knees to rub when walking. This was a lady I had, bilateral varus deformity. We did the one, and she's cutting 1 degree of valgus, probably should have been 2 or 3 degrees of varus. And she did fine, and surprisingly, she comes back, and we do the other knee. And so now we got both knees cut the same way, and she's got this big soft tissue envelope. At the time, I wasn't looking at the joint, I was trying to feel it, and I underestimated my cut. And we did the same mistake on the other side. And now she's got 2 big legs. She went varus over 30 years. I turned her valgus overnight, and both legs rub, and she's not as happy as she could be. So I think that from our point of view, our experience in over 4,400 TKAs is try to restore the native joint lines on the femur and tibia, because your patients will have a pretty quick recovery. The calipered kinematic alignment technique is highly reproducible without soft tissue releases using that technique. We restore the axes to the native joint. People can get back to action and ski. So to summarize, because the goal of kinematic alignment is to restore any deformity to native, if you accept that premise, then there really shouldn't be any limits. And the perils from not cutting the tibia in enough varus, cut in more valgus, are malalignment instability, high medial force and pain, and rubbing of knees when walking. Thank you.